We'll address two elbow joint issues this morning, and this is what is known as what lateral epicondylitis, the medial epicondylitis. So it's just simple. All right, if you look at the elbow like this, okay, so one issue has to do with inflammation on this side, while one issue has to do with inflammation on the outside. Do you understand? So if it happens on the outside, that's lateral epicondylitis. Happens on the inside, that's medial epicondylitis. Do you understand? So they just go, the discussion goes hand in hand. So there are two common issues of the elbow, all right, having to do with inflammation of what tendons around the elbow. So this one is caused by what? Repetitive or overuse. So though they affect different sides, they share similar mechanisms, and they can mostly cause same issues of pain, inflammation. So lateral epicondylitis, this one is also known as what tennis elbow, is happening on the outside. If you know your anatomical terminologies, right? Lateral, something that is outside. So muscles involved have wrist extensor group, especially the extensor carpi radialis brevis. Okay, causes is when you are doing all those repetitive wrist movements, extension, gripping, like they call it tennis elbow because mostly people that play tennis, they are always turning their hand backward. They always use that side. Okay, symptoms is pain over the lateral epicondyle, weak grip strength. Pain worsens with wrist extensions or lifting objects. The medial epicondylitis, that one is known as what the golfer's elbow. People that play golf, they always use that part, and they always have this issue. So location is inside. Muscles involved are the wrist flexor group, especially the flexor carpi radialis, pronator, teres. Causes is repetitive wrist flexion or forearm pronation. So symptoms is pain over the medial epicondyle, tenderness with wrist flexions or forearm rotation, possible tingling in your ring and little finger. That's if the issue now start involving ulnar nerve. You understand? So diagnosis is just clinical examination. You're just trying to look at the places where the pain is. They can do imaging. Do you understand? If from what you observe you still see that it's still not giving you a clear stuff, So lateral medial epicondyle, medial epicondylitis, lateral epicondylitis. So treatment is just rest. Sometimes you just have to reduce the way you use that part of the body. All right. Then non-steroidal anti-inflammatory drugs. So you might want to start taking drugs that are reducing inflammation. Physical therapies, bracings or counter force straps. Okay. So that one is basically for conservative. You can have interventional, where you're using all those corticosteroids, platelet-rich plasma, Then prolonged therapies, okay. Then surgical options, you might actually just want to go in for tendon debridement, tendon release, okay. So but all these other ones we are listing, they are not really things that you're going for first. Okay, first the person should actually go into a lot of rest, okay, for that period.